Ever feel like you're just constantly looking for better ways to manage pain? Or, maybe speed up recovery after you've overdone it or had an injury? It's something most of us think about. Well, today we're doing a deep dive into something really interesting. Our sources are talking about a technology called high-intensity pulsed electromagnetic field therapy, PEMF for short. They describe it as non-invasive, pretty holistic too. So, our plan today, let's really try to get under the hood of this high-intensity PEMF, figure out the science, how it actually works with our bodies, and maybe understand why it's suddenly getting all this buzz as a tool for, well, pain relief and faster healing.
Yeah, it's fascinating stuff. And, it's so important to look at these kinds of innovative approaches, especially ones that seem to work with the body's own systems rather than just overriding them. It pushes our whole understanding of health forward.
Absolutely.
Yeah.
So, okay, let's unpack this PEMF therapy.
Yeah.
It uses electromagnetic fields, right?
Mm.
But the sources stress the pulsed part, high-intensity pulse. What does that actually mean? Why short bursts instead of, like, a continuous field? Is that the key?
That's exactly the key question. You got it. So fundamentally, PEMF isn't about just bathing the body in a magnetic field. It's about delivering these very specific, short pulses of electromagnetic energy. High intensity, but brief. These pulses are designed to penetrate right through clothing, skin, tissue, down to the cellular level. And that's where the magic, well, the science happens. Our sources really point to four main ways this seems to work. First up is something called cellular resonance.
Resonance, like tuning forks.
Kind of. Yeah, that's a good analogy. The idea is that healthy cells vibrate or resonate at certain natural frequencies. These PEMF devices generate pulses that are thought to match those healthy frequencies. It's like reminding the cells how they should be functioning, encouraging them to get their act together with ion exchange, nutrient uptake, basically optimizing how they talk to each other.
Okay, interesting. So coaxing cells back to their normal rhythm. What's next?
Second is improved blood circulation. This one's huge. PEMF therapy seems to boost blood flow, not just in the big vessels, but right down in the tiny capillaries, the microcirculation.
And better blood flow means?
More oxygen, more nutrients getting delivered right where they're needed, especially to tissues that are damaged or inflamed. And that, naturally, helps speed up healing quite a bit.
Makes sense. Carry the good stuff in faster.
Exactly. Then third, there's reduction of inflammation. High-intensity PEMF appears to influence the body's inflammatory response. It can help dial down the production of certain chemicals, these inflammatory mediators, that cause swelling and pain. So, for things like arthritis or even just a sprained ankle, reducing that inflammation is a direct route to feeling better.
Right. Tackling the inflammation head on. And the last one.
The fourth one is really fascinating: enhanced cellular energy. Our sources suggest PEMF therapy actually stimulates mitochondria, the powerhouses in our cells, to produce more ATP.
ATP, adenosine triphosphate, the body's fuel source.
That's the one. The primary energy currency for pretty much everything cells do. So boosting ATP gives cells the extra juice they need for repair work, for regeneration. It's like giving the construction crew more energy to rebuild faster.
Wow, okay. Resonance, circulation, inflammation, and energy. That's quite a line of effects at the cellular level. So here's where it gets really interesting for people listening. How does all that science stuff translate into actually feeling less pain?
Because pain is complicated, right? It's not just one thing. It could be inflammation, tissue damage, nerves getting overly sensitive.
That's the crucial link. We can draw pretty direct lines from those mechanisms to actual pain relief. Take the inflammation reduction we talked about. By modulating that inflammatory response, it directly eases the pain that comes with inflammatory conditions. Think arthritis, bursitis, muscle tears. Less inflammation generally means less pain. Pretty straightforward, that one.
Okay, direct cause and effect there.
Then, promoting tissue repair. Faster healing means less time dealing with the pain associated with an injury or, say, post-surgical recovery. By stimulating cell growth and repair, PEMF helps shorten that painful period.
So getting you back on your feet faster. Precisely. And then there's the nerve modulation aspect. This is particularly relevant for chronic pain. PEMF seems to have this calming effect on nerve cells. It can help make them less excitable, less likely to fire off those pain signals constantly. So for conditions like neuropathy, where nerves are just firing inappropriately, this could offer significant relief.
Sort of like turning down the volume on the pain signals.
That's a great way to put it. And finally, back to the increased circulation. Better blood flow doesn't just bring nutrients in, it also helps flush out metabolic waste products and reduce congestion in tissues. That clearing out process can also contribute to feeling less pain and stiffness. So you see, it's hitting pain from multiple angles.
It really does sound like a multi-pronged attack on pain. Okay, theory sounds good, but what about the proof? What does the clinical evidence actually show? Is this backed up by studies? And, are there gaps? What don't we know yet?
Right, the evidence piece is critical, and it's an evolving picture, as is often the case with newer therapies. But our sources do point to quite a bit of promising research. For example, there are multiple studies looking at PEMF for osteoarthritis, particularly knee osteoarthritis. And many of these have shown, measurable improvements in pain scores and physical function compared to placebo or standard care.
Okay, osteoarthritis is a big one. What else?
There's also research on various chronic pain conditions, things like fibromyalgia, chronic lower back pain. Again, studies reporting positive outcomes, reduced pain levels, sometimes improved quality of life.
That's encouraging.
It is. But, and this is important, our sources also highlight that we still need more large-scale, really rigorously designed clinical trials to nail down the specifics. Things like the optimal intensity, pulse frequency, duration for different conditions, there's still refinement needed. We need to fully understand all the long-term effects and exactly who benefits most.
So promising, but still some questions to answer.
Exactly. It's definitely gaining traction, and the existing evidence provides a solid foundation, which explains why its popularity is growing among both practitioners and patients seeking alternatives.
Okay, so wrapping this up, what we've really explored today is how this high-intensity PEMF therapy seems to offer a pretty exciting, different way to approach pain relief and healing. It's not just masking symptoms, but apparently working at a deeper level, influencing cells, boosting circulation, calming inflammation, really supporting the body's own repair kit, if you will.
Absolutely. I think its appeal lies in that combination of being non-invasive, drug-free, and aiming to restore function holistically. But, and this is the key takeaway echoed in our sources, this isn't something to just try randomly. It's really crucial to talk to a qualified healthcare professional first. They can assess your specific situation, discuss if PEMF is appropriate, and help integrate it safely into your overall health plan. It's about making informed choices, right?
Definitely sound advice. Always consult the pros. So, thinking bigger picture. What does the rise of therapies like PEMF mean for the future? Does it hint at a shift in how we think about managing pain, maybe moving towards harnessing the body's own incredible healing power more effectively? It makes you wonder what other innate capabilities we might learn to unlock down the road. Something to chew on.